I'm Dr. Mo and I'm a dentist. Let's watch together.
I'm Professor Joanna Burke, and whilst writing and researching a recent book about the history of pain, I discovered that down the centuries, our teeth have been a constant source of agony, suffering, and woe. In a world of perfect smiles and pain-free procedures, we've overcome many of the things that made dentistry and our teeth something to be feared. So why does sitting in the dentist's chair still evoke images of torture and horror? I think...
So I'm disgusted with ancient dentists not using gloves. If you're surprised, yes, doctors and dentists did not use gloves at a certain period not so long ago. Go research it later. The medical professionals did not use gloves.
History has a lot to answer for. The past has left an indelible mark on our collective memory. In this film, I'll chart how dentistry has been transformed from a medieval backstreet horror show into a gleaming modern science. Along the way, I'll discover the horrifying lengths some would go to achieve the perfect smile. So basically, if you're rich enough, you can actually get dead men's teeth. I'll get hands-on with the barbaric tools of the trade.
I stick it in someone's mouth.
Carefully, yeah.
And I uncover the unlikely story of how a convicted criminal revolutionized our dental health.
A great thing.
Oh no, this is, I broke it. This is the story of our teeth and of those who have tried to fix them. Rotten and
As I said, people did not use gloves. It's pretty
neglected.
disgusting. A lot of diseases can be transmitted this
Teeth
way.
have been a part of daily life since the dawn of time. But for thousands of years, the only real treatment for a toothache was extraction.
Oh my God.
And there have always been those willing to oblige. If you had a painful tooth in medieval England, you might take your chances with the brute strength of the local blacksmith, or try your luck with another equally unlikely candidate, the barber. Because in the medieval age, barbers didn't just cut hair. At this modern barbershop,
Okay, so this is a fun fact that most of you probably didn't know and would be shocked to hear. Barbers used to literally do like teeth removal and all sort of like medieval nonsense, and it's absolutely ridiculous. You are lucky to live in the age that you live in.
I'm meeting Professor Damien Walmsley, who has researched the brutal beginnings of modern dentistry. Damien, tell me, if we were living in medieval England, and let's say I had a really, really bad toothache, what would I do?
Well, it would depend on how much money you had. I mean, if you didn't have much money, you would go to the common blacksmith, and you wouldn't know what they would be doing to your teeth to take them out. But if you did have money, you'd come to the barber surgeon.
So these are barbers, these are people who do your hair?
That's right, yes. They do bloodletting in the medieval ages, but they'd also take teeth out.
So what kind of training would these dental surgeons get?
They would have been relying on watching the master do the work, and then an apprenticeship they'd have taken over. And do you want to see what they used?
Yes, what?
Here we have simple pliers. So there we are, Joanna. Have a look at those.
Oh, they're really crude.
They are
Really
very crude.
How would you actually use them? Show
Well,
me.
I've got a beer bottle,
Okay.
and I'm going to ask you
So-
to take the cap off with those pliers.
Would
You
it
probably
around
have to
the
hold.
teeth?
You've got to use one hand, or try and use one hand.
Oh.
Yes, it's not.
And you just, and this is the tooth, and
Yeah,
you just
trying
pull.
to pull, and it's not easy.
Oh,
You've got no leverage
No,
there.
I can't.
You've got
I
no
can't.
lever, so you can't get at that. So if you're using such instruments, you would have had to try and get a good application, and you probably ended up grabbing most of the bone, the skin. So as you're taking out with this, you probably took out a lot more than the tooth, and that's if you got the right tooth in the first place.
So he ends it up with, if you got the right tooth in the first place. There are, by the way, medical legal cases where a dentist extracts the wrong tooth. If you didn't think this is terrifying enough, that being said, he mentions the concept of leverage. Leverage not as in financial leverage, as in when extracting a tooth, you need to grip the forceps, not the pliers that you used to use. It's called extraction forceps, and you should hold them in a way and in a direction and insert them in a certain point where you have the most optimized leverage. When you have the most optimized leverage, you will have the most swift and easy transaction for you, extraction. Sorry, dentist is busy with transactions. Extraction for you, and for you as a dentist, and for the patient as well. It's definitely terrifying what they used to do in the barber. And with regard to the apprenticeship, I would argue that the way dentistry is taught these days, to a large degree, it's a form of a more like formalized, structured apprenticeship with a very important theory component, not of course in the barbaric way that these literal barbers used to study, but in similar like rationale, let's say.
In medieval England, extractions weren't just performed for toothache. They were also used as a form of torture and punishment. Those who ate meat during Lent were handed over to the tooth drawer, who would then pull out their front teeth as a warning to other sinners.
I mean, vegans are probably having the best time of their life watching this video.
Those are the pliers. I've got underneath here something called the pelican. Pelican because it resembled the beaks of a bird.
So how would you actually use this?
This part was placed against the skin, and so you would hook onto the teeth, press against the bone, and then actually lever the tooth out. That motion then was picked up with something called a key. And this is, to me, more barbaric, because it actually
looks like a bottle opener.
Yes, very much so. So if you've got the lower, I'm onto the lower teeth there, you would put that on here.
And then you just go...
Just go very, very quickly. Speed was the essence.
Oh.
Ow. So you can see that that could have been really catastrophic for the patient.
Yes, yeah.
There's every chance, as you were ripping that out, it ripped out bone, skin, other teeth.
So I think the message is you don't want to have a toothache in this period of history.
No, you don't. I think that it would have been a very uncomfortable experience and would not have been pleasant at all, with a high chance of infection and a high chance of having to go back again to have the whole procedure done yet again.
For centuries, if you had a throbbing or broken tooth, the sound...
Definitely they had worse infection control measures, if any. I mean, from what I saw, it doesn't seem like they had any infection control measures. Infection control is that concept where we want to prevent the transmission of the disease from not only the dentist to the patient, also from the patient to the healthcare professional, and from the instruments that we use, the professional instruments, not the barber instruments, that we use to the patient himself or herself, also from the instruments to the dentist. And it's like this weird cycle, but it's extremely critical. I am very serious about infection control. I draw a huge line there. I mean, I'm flexible on anything you want, but infection control, extremely critical, non-negotiable for me, with the dental assistant, with the patient, with everyone. This is a red line.
Savage methods of the barber surgeon were the only treatment available. But having a toothache in the medieval era could be more than painful. It could be fatal. In 1665, the year of the Great Plague, if we exclude the thousands of plague victims, around 10% of all fatalities in London were due to teeth. Is it any wonder that dentistry was associated with horror and with death? For much of the past 500 years, that's essentially what it was.
So that explains a lot of terrified patients. Actually, I will tell you something that's extremely interesting in relation to this. A lot of patients who have dental phobia as adults they actually mostly, okay, for the most part, have had a bad experience when they're of a younger age, or even just previously, meaning more recently or long time ago.
For dentistry to move beyond the blunt arts of tooth pulling, aspiring dentists would need to understand the causes of toothache and, more importantly, the anatomy of our teeth. In the 17th and 18th centuries, the worlds of art, philosophy, politics, and science would undergo profound changes. Driving this was the embrace of reason and logic as the way to understand the world. This new movement would become known as the Enlightenment, and dentistry would also be swept up in this intellectual revolution. Previously, the world of dentistry was riddled with absurd theories and populated by charlatans and fraudsters. Even in the 17th century, a myth still persisted that toothache was caused by worms living in the teeth.
Well, it's not caused by worms, it's caused by bacteria, so I don't know if the myth is worse or the actual unfortunate reality. Choose between a worm and a harmful microorganism.
Reputation for quackery and the fact that most dentists were lowly barbers or blacksmiths meant that the profession was held in very low regard. Here at the Royal Society in London is a rare first edition of a remarkable book that, for the first time, applied scientific rigor to our teeth. Its author was a man named John Hunter, who is often remembered as an anatomist and pioneering surgeon. But Hunter was also a key figure in turning dentistry into a modern science. As a young man, Hunter had failed to forge a career in medicine, so instead he turned his attention to dentistry.
So I'm laughing because this is the story of a lot of dental students. You meet with them and they're like, oh, we couldn't get into medicine, so fine, we just did dentistry. Or, oh, we tried to become doctors, but like, we shifted to dentistry. It's like, I don't want to say it's easier, because in my eyes, definitely not, and that was not my story. I chose dentistry from the beginning, but I can't tell you how I met like so many dental students and even graduated dentists who say I was actually trying to become a doctor, but like, you know, whatever, life happened and then I became a dentist. I'm like, dude, what do you mean? Like, this is insulting for us.
I'm meeting medical historian Wendy Moore, who is an authority on Hunter's life.
This is John Hunter's first book. It was published in 1771 and the second part in 1778. And it's one of the most important books in the history of dentistry. And that's because it's really the first in English comprehensive look at the anatomy of the teeth and the jaws. And it really places dentistry on a scientific basis for the first time.
So it's called The Natural History of the Human Teeth.
Yeah.
Explaining their structure, use, formation, growth, and diseases. That's pretty comprehensive.
Exactly, and you can see from the contents, he looks at every aspect of the jaw and the teeth, the muscles of the jaw, the structure of the teeth, the substance of the teeth, the number of teeth, and also he describes the classes or the names of the teeth. So before they were known as the incisors, the canines, and the grinders, but he came up with 4 classes of teeth, and he gives them the name.
So it's not really before. Right now the classification is incisors, canines, and the last one is no longer called that. They're called the molars. Okay, your molar teeth, M-O-L-A-R.
Names of incisors, cuspids, bicuspids, and molars.
Hunter's naming and classification of the teeth is still in use.
So the cuspids and bicuspids, they're situated location-wise before or pre your molars, and hence the terminology pre-molars is assigned to them.
Around the world today.
He discusses the importance of cleaning the teeth. He actually mentions eating fruit and salad to keep the teeth clean. He talks about decay, but perhaps what's most remarkable about the book is these exquisite drawings.
They're amazing. They're so detailed.
They're absolutely beautiful and beautifully accurate.
Yes.
From different angles. And here's a lovely cross-section of the jaw showing the roots of the teeth, which they called fangs at the time.
So these really detailed illustrations, these would have been used for teaching purposes primarily, is that right?
Well, partly, yes. I mean, certainly for teaching students and also qualified surgeons and physicians, but also general interest. People would buy the book as a work of art and as an instructive manual. At the time, dentistry was really looked down upon by most physicians and surgeons. And effectively, what he did was to make dentistry a respectable profession.
As well as setting dentistry on the road to becoming this modern science, Hunter's book also popularized a rather controversial dental procedure, the transplanting of human teeth. In this satirical cartoon, a dentist is pulling the teeth from a chimney sweep, ready to be implanted into the waiting mouth of an aristocratic lady. Lurking in the background is a grotesque character inspecting his new set of gnashers, which had been pulled from two poor children. Few of these transplanted teeth took permanent root, and there was a real risk of contracting diseases like syphilis. But that didn't deter the vain rich. John Hunt.
So, just a fun fact, actual scientific fact, with regard to kids, if their tooth is dislodged, there is a assessment of that tooth, and within roughly 30 minutes to an hour of the same patient, the same kid, it is possible to re-implant that same tooth in that same kid. I'm talking about kids, about pediatric patients. For adult, obviously, it's pure butchery to use a tooth of a certain individual in a different individual. It's a huge violation and a huge no-no. One thing I will say, I have read articles and I've seen oral surgeons, again, for the same patient, use a particular natural tooth of the same patient, and they grind it in a way in a particular machine, and they use it for dental implant purposes. Mind you, they don't actually implant that grinded tooth. They do turn it into something like a powder, and in a sense, to help in the like placement of the dental implant itself. So it's like some form of graft, I guess. And they used then a titanium dental
had fueled a craze, which meant the teeth of the poor became a prized asset to be bought and sold. But within a few years, it was the teeth of the dead that would grab the public's imagination. In the early 19th century, human teeth became an increasingly valuable commodity. In fact, they were so in demand that grave robbers could earn the equivalent of £10,000 a night, stealing the teeth from corpses. These grisly trophies of the dead were used to make lifelike dentures for the rich.
But in 1815, these grave robbers almost went out of business. In June that year, 50,000 men were slaughtered at the Battle of Waterloo.
As night fell, ghoulish scavengers arrived on the battlefield and began to pull the teeth from the dead and dying.
And their teeth, they flooded the British market. As a consequence, even the toothless middle classes could afford to buy their own grin.
The era of fashionable false teeth had arrived. One of the largest collections of false teeth in the world is managed by the British Dental Association. False teeth have a long history. The ancient Etruscans, who lived in what's now Tuscany, were making serviceable gold dentures from around 700 BC. Curator Rachel Bairstow has catalogued hundreds of sets of false teeth, including those made from the dead soldiers of Waterloo.
Rachel, I've heard so much about Waterloo teeth. What do they actually look like?
Oh, well, here we go. We've got a treat for you.
Ooh.
So this is a set of Waterloo teeth. So you can see it's a carved ivory denture, a full set. Top
Ivory?
and bottom.
Yes.
Yeah, this is hippopotamus or walrus ivory was
Yes.
commonly used. And here we have the human teeth. They're riveted into place with these metal pins to make this rather wonderful set.
And how would you actually...
So luckily we actually now use acrylic material and other types of material in order to use to make dentures and prosthetics. That being said, apparently in ancient times they did not have that technology, and they were using random dudes and random chicks' teeth, which is extremely interesting. And obviously it's these teeth carry a lot of diseases on them, so it's a huge violation, obviously, of infection control measures. Mind you, we talked about infection control and how critical it is to keep a very high level of infection.
You fix them inside your mouth?
Well, they'd have gold piano wire springs attached on the sides here, which would attempt to keep it in the mouth through the pressure that would force it up and force it down.
And very difficult to eat with, I'm assuming.
Oh, absolutely. I should think that they probably took it out and chopped up their food another way rather than attempting to eat with this.
I find it amazing. These are actually human teeth.
These are actually human teeth taken from the soldiers from the battlefields of Waterloo. So those healthy teeth that they could find from those dead bodies, here they are, strung up for sale. So these could be purchased from the markets, from some dental catalogues.
So basically, if you're rich enough, you can actually get dead men's teeth.
Yes, absolutely. And yeah, you know, they were very popular to London's wealthy because they just look so much more real.
How long would they actually last in someone's mouth?
Not very long. If you've got to imagine that this is probably a putrid mouth already, there's a lot going on in there. It's not very nice. And ivory is going to decay and it's going to rot in the mouth. So no, for such an expensive set, they're really not going to last very long.
As ivory dentures would rot in the mouth, social gatherings would have been unbelievably smelly due to all the reeking breath.
So I wouldn't, in such process, I wouldn't say that social gatherings are my biggest concern, but I would say rather the transmission of really odd and disgusting and highly infectious diseases in the medieval times. That would be a higher concern for me versus the social gatherings and the breath that I may have on
In the 19th century, the trend for ladies to carry fans wasn't anything to do with flirting, but to keep bad breath from delicate noses.
So it's one size fits all. There must have been unhappy customers, to put it mildly.
There were unhappy customers, and this is a letter from a vicar in Wales who is actually complaining about his set of porcelain teeth here.
Okay, so this is a Thomas Bateman.
Did they just say that there was a trend where women would carry a fan to cover their nose and smelling areas because men had extremely smelly breath? Are we just gonna let that slip? Guys, what do you think? We're getting humiliated in this horrifying medieval documentary that I found, I don't know where.
1810.
Yes, and he's writing to a dentist in London, and he's complaining that his set of mail order teeth don't fit. And what can be done? But there's no way of measuring the mouth, and it literally is mail order, one size fits all.
So this is not a good solution.
So funnily enough, they used to write these reviews as a letter and through mail to their London dentist, where now, I mean, you have your patient going on Google reviews and writing a good or a bad review, hopefully a good review. We don't need to use ancient
Solution.
methods.
When does this start improving? When?
It starts improving in the 1840s, and
So
we
long
see
after Bateman.
long.
So look at the dates that they're discussing. So they're saying 1840s, guys and girls. 1840s is not that long ago. I'm just making things clear for you. So dentistry is modern dentistry. It's literally called modern dentistry. It's not that new. It's relatively recent.
Long after Bateman, I'm afraid. He doesn't get the benefit of vulcanite.
Okay, so this is vulcanite. So
Yes. This is a rubber coming from America.
it's a lot lighter.
It's a lot lighter. It's much cheaper. It's much more cost effective. It's much easier for the dentist to make this.
And it looks better.
It looks better.
Yeah.
It's pink.
It's pink, yes.
So they said it's pink. Look at they're holding both dentures and note how much more natural that pinkish look is in comparison with that pure whitish look that they had in more previous. I'm just showing you the iterations of a dentist before the dentures before it reached the final denture that we have. Actually, the final denture we have, you can also show some details of veins, artificial of course, details of veins and so forth to make it look so natural. I have a colleague prosthodontist in South Korea, and he makes really amazing dentures. I mean, I will see if it's possible to show a pic or something, but
Looks better. It would fit better. It's more easy to eat with these ones.
Yes, it's much easier to eat with these. They were cheaper to mend and fix, and a set of these would probably last you your lifetime. So, you know, combine that with an anaesthetic, you would have a complete clearance of the mouth, and a set of these fitted. You know, that's cost-effective dentistry for the rest of your life, isn't it? That's what was thought.
False teeth were a potent symbol of the dentist's stock in trade. Bloody and painful extractions. To protect our teeth from the ravages of decay, new inventions would be needed to help keep them clean.
Again, nobody is using gloves, and that's a very advanced case of tooth decay.
In 1780, a rag trader named William Addis was arrested near Spitalfields in London for his part in organising an anti-government riot. He was found guilty and thrown into Newgate jail. While sitting in his squalid new home, he had a remarkable brainwave. In his cell, William Addis was attempting to clean his teeth using a piece of old rag when he saw a broom in the corner. Realizing that a brush would be much more effective, he set about making a prototype. Addis had used a piece of bone left over from his supper to make a handle, and he persuaded a guard to buy him some bristles. The modern toothbrush was born.
Oh my god.
Here at the Kent Brush Factory in Hemel Hempstead, they still make brushes by hand, using methods and materials that William Addis would recognize. When he started experimenting with his new invention, William Addis realized that for an effective but gentle brush, he would need to add a rather special ingredient: pig bristles. Today, Kent imports their fine pig hair from Siberia, where the cold climate produces a sturdy bristle, perfect for toothbrushes.
So now you could order I would say really high quality good toothbrush just from Amazon and get it within 24 hours. They had to manufacture things in somewhere in random Siberia, and you saw how horrifying it looked. And obviously this was the start of the innovation, and luckily we have these things. So guys and girls, use your toothbrush.
So how long would it take to make just one toothbrush?
Takes me about 15 minutes.
15 minutes, that's
Yeah.
a long time.
Yeah.
Yeah, because
So 15 minutes to make that manual toothbrush is actually much faster than I thought.
of course when they were first made, they were all done by piecework.
Yeah.
So you only got paid for the ones you made. So obviously speed was the really most important thing. Dawn, I've been watching you now for a while. I don't think I can do this, but can I have a go? At least
you're
trying
welcome
to.
Yep, be
Hey.
my guest.
Oh dear. So what do I do, Dawn? Talk me through this.
Right, you've got to make a loop.
Make a loop? Oh yes,
Yes.
make a loop.
If you poke it through the
Poke it
next
through a hole. Is that at the hole? No, it's not going
Be
through.
nice and straight.
Oh dear. I'm going to mess up this one for you, aren't I?
That's all right.
Oh dear. There, I've done it. I've got it through the hole. Okay, then you... Okay, then I make them... I watched this bit of what you were doing really carefully. Then you put it in, and then you divide it in half. You put it like that.
Halfway, yeah. Bend it in half.
Bend it in half?
So they're both straight.
Oh, that's hard to do.
Yeah, that's a bit of practice.
They're really tough. Okay. Then I just pull it, do I?
Yeah, the long bit.
The long bit. Okay. That's...
Get more of a grip then. Oh,
Oh no, I broke it. This is when you have to start again, isn't it?
yeah.
Oh.
Well, take a few bunches out, yeah.
I'm really sorry,
That's
Dawn.
all right, don't worry.
Okay, so I've really messed up badly here. And if this was piecework, you would have just lost actually a sizable part of your daily income.
Yeah.
Okay, that's as good as I can do.
By inventing the toothbrush, William Addis would be transformed from a jailbird into a successful businessman. Within a decade, he had amassed a vast fortune, and his toothbrush would become a fashionable item for the wealthy.
William Addis's eureka moment was to prove a milestone in dental hygiene. But it was only the first step in a long road towards healthy teeth. After all, each of his toothbrushes cost 6 pennies. This was far too expensive for most of the population.
For a long time, even those who could afford a brush would often share it with other family members. But the toothbrush isn't the only thing people...
It's probably not a good idea. Definitely not a good idea. So you're transmitting all sorts of diseases, horrible hygiene, and horrible infection control. Definitely, that's the most disgusting and bizarre thing I've ever heard in my life.
people have used to try and clean their teeth.
It's tingling fresh. It's fresh as ice. It's Gibbs SR.
In September 1955, this was the first ever advert seen on British television screens. A milestone for both TV and our teeth.
See your dentist regularly and brush with SR, the tingling fresh toothpaste for teeth and gums. Gibbs SR.
Dude, that is not a bad advertisement, to be fully honest, and they bring a model and everything.
Using weird and wonderful concoctions to clean our teeth isn't a modern invention. It stretches back thousands of years. In ancient Rome, it was common to rinse your mouth with urine in order to give them a pearly white appearance.
What did I just hear? Okay.
I'm meeting Dr. Martin Ashley of Manchester University Hospital, who has researched the often bizarre methods that people have used to try to
Definitely never dating someone from
keep
Rome.
their teeth clean.
So look, Martin, what really interests me is how did people actually brush their teeth in the past?
Well, Joanna, way before we got toothbrushes, some people liked the idea of having clean teeth. Not everybody, but some people did, and they would use pretty much whatever they could get their hands on. And they recognised the need for something a little bit abrasive to clean the dirt off their teeth. This is oyster shells that are ground up.
Can I touch?
Yeah, by all means, yeah.
Ooh, it's
Yes.
pretty abrasive.
It is, isn't it? Rather than show that on my own teeth, I'm going to show you on a Perspex block that we have. We use this when toothbrushes are being tested in toothpaste. It's not quite as hard as enamel, but if we see an effect on the plastic here, we know eventually it would affect the enamel as well.
So you just use your finger?
Yeah, we believe so. And so forgive me, I won't do it. But to apply that to the surface of a block there.
Oh, yeah.
And presumably that's about the pressure we would use, finger pressure on there. And do this.
Yeah.
I can feel the roughness there. This is 1 day. This is 1 day's worth of brushing. You can feel the difference there. So it doesn't look a lot.
Yes.
But the next day and the next day, and do this year after year. And there'll be nothing left of the teeth. It's too abrasive.
Yes. Okay, this would be better though. This seems. What is this one?
This is soot. This
Soot,
is chimney
yeah.
soot. And so, again, readily available. Rather than just use their finger there, they probably would have used a bit of lint or some sort of cloth.
So what period are we talking about for this?
Probably Tudor times,
Tudor.
I think. And then rubbing some soot on your teeth. And what we...
Well, that's a bit smoother, isn't it?
It is. It's not nothing like as gritty as this, and it tends to break up gradually in the water. But the idea, I suppose, it came from a fire, so it was thought to be...
So this reminds me of these random trends, dental trends that we see on TikTok of people doing horrifying stuff.
Clean.
Yeah.
And then a mouthful of this looked very dirty, and then as you spat out and rinsed out, your white teeth emerged and looked clean, and as much the contrast, the darkness as anything else. My least favourite one, yes, my least favourite. The idea of...
Can I?
Yeah, again, this is brick dust.
Oh, I can hear it.
Goes right through you, doesn't it?
Oh, that's awful.
I can't imagine this in my mouth.
So this would really wreck your teeth.
Yeah, if I just wipe that clean for you, you feel the difference there.
That's
that draws
very
into...
abrasive.
Yeah.
That's the worst, I think.
Yeah.
What would happen if you brushed your teeth with this every day?
Immediately you're getting through onto the enamel of the teeth, and it would just scratch it through and through, so the protective coating goes, the natural bright surface from the tooth goes. Without the enamel there, the tooth is even less resistant to the abrasions.
It wasn't
So just one added note here that the actual toothbrush is abrasive to the teeth. Okay, so even the toothbrush we use now, definitely not to the degree that these things are being shown. And also, if you use a hard bristled toothbrush, it also is even more abrasive toward the teeth. That's why another reason, other than the pH of the mouth following eating, that we don't really advise to brush it directly after eating, to wait at least for 30 minutes, because your teeth would be more vulnerable. And I talked about this in previous videos, something in relation to a Stephen curve and pH of your mouth and so forth. Is that the toothbrush itself is abrasive, but definitely with the technology that we have in the creation of modern toothbrushes, it's not as bad of these random stuff they use.
just cleaning our teeth that caused problems. Throughout history, teeth have been at the mercy of everything we've put in our mouths.
Jerry knows that there are certain foods we should eat to help keep our bodies healthy and develop healthy teeth. Why, this very morning, Jerry and his sister Susie started with a good, nourishing breakfast, because eating the right foods can help you to keep healthy, and your teeth will have a better chance to grow and develop.
Unfortunately, we've not always been as well informed as Jerry. For huge swathes of the past, what we ate had a pretty disastrous impact on our teeth. In the Museum of London's archives is a unique record of the changing state of British mouths. In these boxes are the remains of hundreds of long-dead Londoners. Each and every one can tell us something about the diet and bad habits of the past. I'm meeting archaeologist Mike Henderson, who has spent years charting the changing fortunes of our dental health.
Teeth are one of the hardest, densest substances in the human body, and so we can get lots of information about a person's diet, their health, their oral hygiene. So one of the things we see commonly in the medieval...
That's 100% true. First of all, the fact that he said that teeth is one of the hardest is because of the enamel. Because of the enamel and the constitutes of the enamel, the most outer layer of the part of your visible tooth. That's called the enamel. It's one of the hardest, if not the hardest, I think, in the body. But it's brittle, so it's like a glass. The glass is hard but brittle, and so is enamel. Secondly, for sure, you could get a lot of information about a person just from their teeth.
Earlier populations is dental attrition, so this is wear on the surfaces of the teeth. So you can see here that the teeth have worn down to the dentine, this orange surface there, and that's because the...
So this tooth wear is very common in patients with bruxism, and it's called occlusal wear and incisal wear. Incisal for the front and occlusal wear for the back. It's your teeth keep on grinding on each other or on foreign objects, but when it's generalized like this, it's most probably because of the upper teeth grinding on the lower teeth. Especially common in patients with bruxism.
Diet was a lot coarser. If you imagine grinding flour on a mortar to make bread, parts of grit are going to get incorporated in that. As you eat that, it wears the teeth down over time.
Once the stone and grit in bread wore your teeth to the pulp, the nerves would be exposed, and it's likely you'd be in constant agony and suffering.
And this one here, this looks also like a person who's got a bad toothache, or a lot of bad
Yes.
toothache.
Now, if you have cavities, a side effect could be bacteria enters the tooth, and if it reaches the pulp chamber and starts to cause inflammation, pus starts to build up and causes a lot of pressure, and it needs to escape. And this is where you see these sinuses, these abscesses forming.
So this is where pus has tried to escape the jaw.
Yes, to relieve the pressure.
But the pain and decay of the past would be nothing compared to what would happen when our teeth were exposed to a new luxury commodity.
Towards the 18th, 19th century, as sugar becomes more commonplace in the diet, more affordable, all rates of dental disease, decay start to shoot up.
This one here looks a very serious case. I mean, as far as I can see, he or she doesn't seem to have any teeth.
So this is an older female, potentially as a result of decay. She has lost all of her teeth. You are more likely to lose teeth as you get older. You're more exposed to sugar in the diet. But people also had their teeth taken out to prevent further suffering in life.
I'm a modern historian, so I'm actually much more used to dealing with paper in an archive rather than dismembered human skulls. But it really is fascinating to see evidence for what diet and sugar did to our teeth.
The arrival of sugar on British shores was a dark day for our teeth. And our insatiable appetite for all things sweet would have huge social, political, and economic consequences. From its very beginnings, the British Empire was built on the back of the sugar trade. From the 16th century, vast sugar plantations in the West Indies churned out massive quantities of raw cane sugar for export to Europe. In turn, the sugar industry would drive the expansion of the brutal slave trade, which provided the labor needed to harvest and process all that sugar. It isn't actually sugar that causes decay. Sugar sticks to our teeth, providing fuel for harmful bacteria, which in turn produce an acid. It's this acid that corrodes tooth enamel, eventually leading to cavities. From sugar's first arrival on these shores, the British public couldn't get enough of the sweet stuff. And over the next few centuries, our teeth would suffer the consequences. But for many years, sugar was the preserve of the rich, initially the nobility, and by the Georgian age, the middle classes. But all that would change in the reign of Queen Victoria. In 1874, the Prime Minister, William Gladstone, would finally repeal a punitive tax on sugar. For the first time, millions of people could afford to indulge their sweet tooth. In the next few decades, sugar would wreak havoc in the mouths of working-class Britons. The age of mass tooth decay had arrived. The impact of sugar on British mouths was highlighted during the Boer War. It was discovered that many British soldiers had teeth so bad that mincing machines were needed to allow them to eat. As our teeth began to decay en masse, dentists would have to find new ways to try and stop the rot. In the past, a cavity would usually spell the end for a tooth. What was needed was a way to repair the damage and prevent further decay. One Victorian solution was to hammer small lumps of gold into the cavity, a long and painful procedure. But all that would change with the discovery of amalgam, a blend of mercury and silver, which allowed dentists to fill cavities fast. But fillings would only really become successful when dentists also had the means to quickly and effectively remove the decay. Professor Tim Watson of King's College London has collected together some historic dentist tools to demonstrate just how difficult drilling was in the past.
What would they do to me if I went to a dentist 19th century?
But if you had a cavity that needed working on or filling, then they would have used hand instruments. This is an example of a hand drill.
So this is Victorian period?
This is Victorian period.
Yes.
Put that into the end of it, and then that twists, and you twist it between your fingers, and that way you can then remove the decay. Do you want to have a go?
I want to have a go, yes, thank you. Put that over that finger.
That's right. Very good.
Then
Make a dentist of you.
Oh, okay, and it just sort of rests in there.
That's right.
And then I stick it in someone's mouth.
Yeah, carefully, yes.
Carefully,
Yeah.
yes, and
hope you don't go where you shouldn't.
I just stab them.
Absolutely.
Okay, so
it would be really quite tricky to use, and it would only work actually in the very soft decay. It wouldn't cut the sound surface of the tooth at all.
It's no wonder that Victorian dentists had such trouble drilling teeth by hand. On a mineral hardness scale, tooth enamel ranks as tougher than steel.
So this is very, very slow. What came after this?
Well, there were various inventions of mechanical ways to drive the burr around quicker, but the thing that revolutionized dentistry was the development of the treadle dental engine.
Oh, this looks more elaborate.
What we have here is a handpiece and mechanical drive, and that was powered by a treadle, which was foot operated.
So how fast would this go?
Oh, quite a lot faster. You're in the hundreds of RPM rather than single RPM.
It's quite difficult to do, isn't it?
It requires coordination.
Can I have a go at this as well?
Okay, there we go.
Okay. Okay, cavity, here I come. Okay, so this is my poor patient.
Yeah.
Oh, kind of like a sewing machine.
Absolutely, yes.
And then you just put inside the person's mouth and
drill away.
Drill away like that.
Yeah.
This inside your mouth must be quite horrifying.
Well, yes, indeed. Yes,
And you can
yes.
hear the grinding noise going. So.
Well, yes. But, I don't think I'll be coming to you in a hurry.
The arrival of the treadle drill really did change dentistry forever. For the first time, dentists could fight back against cavities and save our teeth from extraction. But to make full use of these new tools, dentists would have to overcome the problem: their screaming, struggling patients. In the distant past, pain relief left a lot to be desired. If you were lucky while having a tooth extracted, you might be given a slug of whiskey.
What we saw is
Or
the
you might
evolution
need to seek
of
comfort
a dentistry
in prayers to
from
Saint
barbaric,
Apollonia,
literal,
patron saint
like
of
barbers
dentistry.
doing random work
Pain
with zero
would only be
consideration
uncommon
to
in the late 19th
infectious,
century,
to
through the discovery
infection control, or even zero consideration to infectious diseases, into gradually moving into a more like hand manual instruments, then gradually having an evolution to a bit more advanced machinery, advanced as in for the time that they had. And this is how like medical devices and dentistry advances. It's an evolution. It's not a 0 to 100, it's a 0 to 1, and then a 1 to 5, and then a 5 to 10, and then a 10 to 20, and then a 20 to 50, and so forth. So now they're going to address the pain control aspect, because as they showed you really horrifying scenes of patients suffering, well, how do we fix this? And you saw they're applying that sort of, looks like they said general anesthetic, or it could be into, I'm assuming nitrous oxide can also be used for sedation. So that's the feeling following the having nitrous oxide sedation. Patient may feel lightheaded, they may having tendency to laugh, hence the terminology for nitrous oxide sedation as in laughing gas.
And gases. The first substance to be used as a general anesthetic was nitrous nitrous oxide, or laughing gas.
This is one way to keep a child quiet. Perhaps you'd like to do this for your child sometime.
Laughing gas had been used as a recreational drug for decades, when in 1844, an American dentist named Horace Wells spotted its potential.
One day, Horace Wells was sitting in the audience of a laughing gas roadshow, where members of the audience would be invited on stage to try some gas. Once intoxicated, these guinea pigs provided entertainment for the rest of the audience. But then, Wells noticed a very interesting thing. One man came off the stage with a very serious gash in his leg, but he felt no pain.
To discover just how effective nitrous oxide is, I'm going to be administered a carefully controlled dose of gas and air, the same mixture of oxygen and laughing gas used in maternity wards. In 1844, when Horace
so for
Wells
people complaining
experimented
of
on
needles,
himself,
you can see
he had a
how
friend who had a
barbaric
tooth.
things were being done.
I'm not going to have...
Like hand manual instruments, then gradually having an evolution to a bit more advanced machinery, advanced as in for the time that they had. And this is how like medical devices and dentistry advances. It's an evolution. It's not a 0 to 100, it's a 0 to 1, and then a 1 to 5, and then a 5 to 10, and then a 10 to 20, and then a 20 to 50, and so
Salts and gases. The first substance to be used as a general anesthetic was nitrogen.
So now they're going to address the pain control aspect, because as they showed you really horrifying scenes of patients suffering, well, how do we fix this? And you saw they're applying that sort of looks like they said general anesthetic, or it could be into, I'm assuming nitrous oxide can also be used for
Nitrous oxide,
sedation.
or laughing gas.
Yeah.
This is one way to keep a child quiet. Perhaps you'd like to do this for your child sometime.
Laughing gas had been used as a recreational drug for decades, when in 1844, an American dentist named Horace Wells spotted its potential.
One day, Horace Wells was sitting in the audience of a laughing gas roadshow, where members of the audience would be invited on stage to try some gas. Once intoxicated, these guinea pigs provided entertainment for the rest of the audience. But then, Wells noticed a very interesting thing. One man came off the stage with a very serious gash in his leg, but he felt no pain.
To discover just how effective nitrous oxide is, I'm going to be administered a carefully controlled dose of gas and air, the same mixture of oxygen and laughing gas used in maternity wards. In 1844, when Horace Wells experimented on himself, he had a friend pull out a tooth.
Well, I'm not going to have a tooth extracted, but I do want to test its pain-relieving properties. I have a needle here. Let me just prick myself. Ouch! That really, really hurt. Let's see if this works. Whew. Let's see now what happens. Actually, it doesn't feel like anything. I feel really quite lightheaded. And am I slurring my words? I'm not sure. But anyway,
So that's the feeling following the having nitrous oxide sedation. Patient may feel lightheaded. They may having tendency to laugh. Hence the terminology for nitrous oxide sedation, as in laughing gas.
Really, it didn't hurt because I pricked myself a few times that time. Yeah, I don't really know what to say now. Just cut. Okay.
Nitrous oxide undoubtedly worked, but during a public demonstration, Wells failed to give his patient enough gas. He was humiliated and his discovery discredited in the eyes of the medical profession. But that wasn't the end of the story for pain relief. And to find out what happened next, I've come to the School of Pharmacy at University College London. I'm meeting Dr. Stephanie Snow, an authority on the history of anesthesia.
So, laughing gas is not working. So what comes next?
Well, soon after, dentists and surgeons began to use chemicals. First they start with ether, and then they use chloroform. Ether is discovered first by American dentists. It was a safer anesthetic than chloroform, but it was harder to establish unconsciousness.
So how do they administer these drugs? And are they both administered in practically the same ways?
Yes, the chloroform would be dropped or poured onto a sponge.
So this is just an ordinary sponge?
Yep, just an ordinary sponge. The sponge would then be wrapped up in a cloth, a handkerchief, whatever they had to hand, and then it would be pushed over the patient's nose and mouth.
Oh, that's
and
really
they would have to be held.
That's really suffocating.
That's right, yes.
So this is a very imprecise method of administering anesthetic.
Completely. I mean, if we look at this, a fatal dose would be something around 30 mils, which would be around that.
So for people complaining of needles, you can see how barbaric.
So if you're using a spoon or a dropper even, it's very easy to go over without realising it.
So there were quite a few fatalities?
Yes. Chloroform particularly had a high level of fatalities. And it was really because of that that by the 1860s, dentists started going back to using nitrous oxide because it was much safer.
Despite the risks, ether and chloroform continued to be widely used alongside laughing gas. But another discovery would soon change pain relief forever.
Oh my God.
Ether
Sorry. What is going on? So people complaining of needles. You have literal like ancient dentists suffocating people with toxic materials.
And chloroform were general anaesthetics. What dentists really needed was a way of targeting pain relief, of being able to numb and deaden pain just in one small place in the mouth or jaw. So it's here that we turn to coca in the story of pain relief.
So this is cocaine?
This is cocaine. It's produced from coca leaves. It was used for many years as a stimulant. It was used in...
She's trying to give it a cool name, like, oh, that's where we thought about coca. Like, she's like, what the hell is coke?
Tonics in Coca-Cola, of course. But in 1884, an eye surgeon in Vienna, Karl Koller, discovered that it had anaesthetic properties. And what he did, he made a solution of cocaine, administered it to his eye, and then stuck needles in his eye and found that he experienced no pain.
So this...
Why was everybody experimenting on their literal own self? I mean, didn't she just say the nitrous oxide person? He was like, oh, he tried nitrous oxide. And then the literal reporter, she's like, oh, I'm going to stick myself and try nitrous oxide, whatever she applied. And now we have somebody sticking stuff into his literal eye. Like,
this obviously is an advance over chloroform or ether. How did they actually administer this kind of anaesthetic?
Well, in parallel with the discovery of local anaesthetics like cocaine, the hypodermic syringe was invented, and this enabled them to actually deliver cocaine.
Just to be clear, if you're actually shocked, we do learn about these things in dental school, and so there's a lot of what she mentioned, which I'm trying to avoid using that term, is also part of anesthetics. Of course, not used anymore, but there's also, if you notice the end of the term, it's like caine, right? Like cocaine, and because there's also prilocaine, and there's also like mepivacaine, and they're ending because they're from the similar family of drugs.
To a specific part of the jaw or the mouth. Then the needle is just there. But as you'll see, it's not very fine at the end.
That's not fine at all.
No.
Actually, that would be quite painful going into you.
Yes. Yeah.
And then they would just administer it like that.
Yes. But I mean, if
Honestly, that does not look too bad, just with the exception of the needle part itself. If you look at the syringe that modern dentists use, actually a quite terrifying syringe. If possible, I will.
You think about the sort of precision of that, being able to target a particular spot. That was a much safer way of giving dental patients anaesthesia than ether or chloroform.
Yes, no, obviously. Yes.
So the challenges with nitrous oxide is that it's a bit more generalized, not a bit more, it's literally more generalized, whereas they're trying to find a solution to give not necessarily only a safer anesthetic, but a more localized, targeted anesthesia. And to this day, actually, it's quite challenging to achieve really good anesthesia. I would argue it's a bit more challenging to achieve it in the lower jaw compared with the upper jaw. We have good enough pharmaceutical drugs that we could use rather anesthetics, just to be more specific. Like the most common one I personally use as a dentist is lidocaine, and lidocaine is having something called, as you probably heard of before, but that's adrenaline. And the reason adrenaline is added is because it gives a lot of it empowers the anesthetic and gives a lot of positive benefits to it and to the patient, inclusive of helping with the bleeding control at the site. Also, it makes the anesthetic more potent. It makes the anesthetic lasting a bit longer in the duration. So some patients are having medical issues where they cannot have adrenaline with the anesthesia, so we give them anesthesia without adrenaline, and that's fine, and we can do the job, but you remove all of these empowering factors that the adrenaline gives to the traditional dental anesthetic.
By injecting cocaine directly into the gums, dentists could now numb individual teeth, providing a much safer and easier way to carry out fillings.
Did you just say much safer? Obviously, this is ancient dentistry. We don't practice this anymore. They just did not have...
The arrival of pain relief was a major turning point in the history of dentistry. From that moment, dentists could perform more and more complex procedures on our teeth. But painless dentistry did not mean that it lost its reputation as a terrifying and agonizing ordeal. Nothing better demonstrates the public perception of dentistry than the release in July 1914 of Charlie Chaplin's film, Laughing Gas.
So I had no idea that Charlie Chaplin was playing a dental assistant.
Helped cement the idea that a visit to the dentist was still as barbaric and painful as ever, despite all the new technologies and use of anesthetics. Just a month after the release of Chaplin's film,
So if you're complaining of anesthetics, that's how I saw a random picture of a medieval time, somebody putting something like a metallic head cover, and someone literally smashing their head, and that was an anesthetic.
Dentistry would take another huge leap forward during the calamity of the First World War. In August 1914, the British Army went to war without a single dentist. But that would change when one of the most senior British generals got a toothache. When General Douglas Haig was struck down with a sore tooth, he was shocked to discover that there wasn't anyone in British uniform who could help. Instead, a French civilian had to ease his suffering. Haig's toothache would have an immediate impact. By the end of 1914, there were 20 dentists at the front and over 850 by the war's end.
So 1914, and look at the number of the ridiculously low number of dentists that were available. 1914, if I heard correctly, it's not that
But
long
dentists
ago.
weren't just needed for toothaches, fillings, and dentures. The nature of trench warfare meant that soldiers' heads were often exposed to fire. And high-velocity bullets and shrapnel smashed faces beyond recognition. Huge numbers of men flooded back to Britain with faces seemingly damaged beyond repair. Many of their injuries were so severe, it seemed a miracle they had survived at all. Working in conjunction with plastic surgeons, dentists would be at the forefront of rebuilding these men's faces and their lives. I've come to the Royal College of Surgeons, where there's a unique record of how dentists treated these shattered faces of World War I. I'm meeting historian Kristen Hussey, who has researched these pioneering dental surgeons and their patients.
Kristen, what do we have in front of us here? We've got a file. Yarnold.
Yes?
Tell us about this particular man.
So what we're looking at here is this man's case file. You can see he was wounded in October of 1918, so very unfortunate, very close to the end of the war.
Age 24.
Yes, very young man.
Yes.
And you can see here that he's received a gunshot wound of the chin and a fracture of the mandible.
Gunshot wounds and shrapnel blasts caused some of the most disfiguring of all injuries, often removing entire sections of the face and jaw.
One of the first things they would have done for him was extract teeth. Now, teeth would often have become septic on the trip from the continent back to Britain, so they were one of the first things to go, and indeed, dental surgeons would have been one of the first people he encountered.
What did the dental surgeons actually do? What were they able to do in this period?
One of the number one things dentists would have done was provided splints to support the jaw in order to aid its healing, but also they crafted incredible dentures and external supports to really recreate the structure of the face, that hard tissue structure that the plastic surgeons could then graft over. And if you look here at the images, you can see that he's lost the majority of his jaw on that side.
It's all gone.
Private Yarnold's injured chin was being repaired with a tubular skin graft grown from his neck.
So not only are the plastic surgeons rebuilding that area with skin grafts, it was also suggested by the consulting dental surgeon they use a bone graft to sort of fill in that gap.
And what bone would be used from his body?
They would have used a graft from the tibia, so the shin bone, to recreate that part of the jaw, which was a very pioneering technique at the time. Unfortunately, with this soldier, it was decided it wasn't advisable. He wasn't strong enough to undergo that treatment.
So there are different areas where the surgeon may take a bone graft from. She mentions like from the bones of your legs. That's where tibia is. They're also taking a bone graft from the areas of the mandible, if feasible, and so forth. So we can take a bone graft from the
Course of
same
the
person
war,
and
over
apply.
60,000 British soldiers received facial injuries. These wounds were often so severe that dentists had little idea what they were dealing with, so specialized techniques were needed to diagnose and plan treatment. One method was to make dental casts of the injured soldiers' mouths.
This is quite a striking image. You can see that the gunshot has entered the jaw just there, carrying away a significant proportion of the bone.
So what would happen to a man with a wound like this?
Well, this dental cast would have been really the first step towards his healing, because it would have helped them visualize the injury, but also plan the procedures, the surgical operations to be carried out.
Another important tool for diagnosis was the X-ray, which had been discovered in 1895, but its use was still in its infancy. Dentists and plastic surgeons adapted and improved existing techniques for use on the face.
I thought you would be...
I mean, that looks pretty terrifying for a dental X-ray, and actually the modern dental X-ray machine, in my personal opinion as a dentist, also still looks quite terrifying. I mean, the problem is, because we study the design, we take a dental radiology course, and the design is functional. It's functional, it's logical, like similar to the anesthetic syringe. and there's a reason why it's designed in this way. I just wish if there was somebody who would like redesign it in a sense, but it functional, it does the job. It looks like it's for a reason.
Interested in seeing this one.
So what is this? What does this show?
You can see the extent of the gunshot injury of the lower jaw. Obviously, it's been splinted, probably by someone in a clearing station to send them back to Britain. But all of these dark spots you can see are dirt and probably cloth that had become caught in the wound when the blast was received to the face.
So we have a real problem here with infection.
Exactly. And that was why the dental surgeons were so important in removing teeth. They were trying to make the mouth and the oral cavity no longer infected so they could proceed with treatment. It was a challenge for dental surgeons to try and tackle the extent of these injuries that they had never experienced in peacetime. But for the soldiers who had facial injuries in the war, there really was no final end point. It was always going to be a struggle for them.
There's one major debate. Is war good for medicine? Well, unfortunately, in the case of facial surgery, it was. In the crucible of the First World War, it took pioneers to radically transform surgical practices. In doing so, they literally changed forever the lives of so many men who otherwise would have lived out quite miserable existences.
By harnessing new technologies, dentistry was on the road to becoming the modern science we know today. But at the same time, our teeth were gradually getting worse. Years of sugar consumption meant a whole generation had rotten mouths.
In the early 20th century, dental care was so expensive that some people would choose to have all their teeth extracted in order to avoid a lifetime of dental costs. Believe it or not, having all your teeth removed was considered a perfect gift for a 21st birthday or a newly married bride.
I don't know about newly married couples. Would you like that as a gift? Getting all of your teeth.
Pain, you know, they were terrible. They wanted to go and I'd keep having toothache, so I thought, oh, right, get them all out together. So I got them all out.
Just decayed and I had to get them out to suffering agony and pain.
As we said before, they're not using gloves. It's just sheer lack of infection control measures.
British teeth would take on a whole new importance during the Second World War. Bad teeth wouldn't just be a national embarrassment. They'd become a matter of life and death. As the Battle of Britain raged and bombing missions began over Germany, the Royal
I remember we started
Okay,
off
so what they were showing in the video is actually a legitimate instrument, and it's called the scaler. Scaler helps in the removal of the plaque and calculus, and it is a dental hygiene instrument used by both dental hygienists and dental professionals like dentists.
carving wax blocks. We were given a tooth and we had to reproduce the tooth. This was to increase our manual dexterity, which I think it did.
After we had
So
done
I
that,
absolutely
we
hated
moved on to
carving. We used to do it in university. It's not because of lack like artistic skills. It's just extremely time consuming, and I didn't really see so much of a resemblance of an actual tooth, a real like natural uh, dentistry being practiced on a wax block because of the sheer significant difference between a wax structure and the tooth, like in a realistic structure.
door handles. These were mounted onto the headrest of the dental chair, and the door handle was painted. And we then, with a variety of instruments, had to remove the paint. And having removed the paint, it was then replaced, and we removed it again.
Having trained for 9 months, scraping paint and learning about anatomy, hygienists went to work immediately, improving the teeth of pilots and aircrew.
In those days, the mouths were pretty awful, really. And we remove all the debris, and then we suggest that they used a toothbrush, might be a good idea. And then we sent them away, and they came back 6 months later, and we did it all
Honestly,
again.
sounds like like the situation now didn't change from ancient times with regard to. I mean, not all patients are like this. Of course, a lot of patients are compliant and they take care of the oral hygiene.
Few years, a trip to the dentist wouldn't be complete without a hygienist giving you a scale and polish, and perhaps a bit of friendly brushing advice.
It takes at least 200 brush strokes to get around a complete set of teeth properly. And Sally is told that this should take her approximately 3 minutes every time
Notice
she
how
cleans her teeth.
she looks like a hygienist, teaches the patient how to brush, and then actually somewhat of a correct technique because she's putting the toothbrush at a particular angle that you cannot tell much, but it's like almost 45-degree angle, just trying to clean the debris from the gum area and the tooth where that debris and plaque get stuck. So it's somewhat of a good, actually a good technique.
During the Second World War, millions of ordinary Britons had been given free medical and dental treatment by the armed forces. When peace finally arrived, many believed that this duty of care should be taken on by the state.
To make this happen, the government commissioned an economist named William Beveridge to investigate what ordinary Britons' lives were like. His findings would lead to the creation of the welfare state and a new national health service.
This leaflet is coming through your letterbox one day soon, or maybe you have already had your copy. Read it carefully. It tells you what the new National Health Service is and how you can use what it offers. Study the leaflet, then keep it by you. You'll need it for reference.
From the 5th of July 1948, all aspects of medical care would be provided free of charge. When the first wave of patients arrived, dentists set to work rectifying years of neglect.
There was a hell of a lot of work to do when the NHS came into being. Mainly extractions to begin with, and dentures. And then, you know, the fact that you could save teeth pretty painlessly, gradually seep through the population. And they came and had their dental treatment, had the fillings done.
In just 9 months, NHS dental technicians made over 33 million replacement teeth, and dentists filled over 4 million cavities. There were long queues outside some dental surgeries, and overworked dentists were seeing hundreds of patients a day.
Well, I've been
In the
showing
first
that
few
everything
years,
just prospers when an economist like involved, and they're like all of these people trying to use different random things in the evolution. Earlier in the video, they're like plug in an economist, and they're like they're using an upbeat music, and everything is prospering.
the NHS dental budget was more than double what had been planned. So, in the early 1950s, charges for dental treatment
So this
had to be
actually somewhat
introduced.
resembled of like ancient times where dental students, or perhaps, I don't know if these are graduate dentists, but I would assume dental students are actually practicing now. We have better, more advanced, definitely, equipment and more advanced rooms, and we actually practice for a long period of time on dummy patients, which are not real patients, and then we proceed forward during our dental degree to there, should I say, practice on real patients, of course, with their consent, under the supervision of specialists and consultants. And people are terrified of this, but let me tell you, I actually, on a personal level, not to brag about myself, but I did amazing work as a dental student and as a graduated dental professional. But definitely, of course, students, I'll tell you the caveat is they're going to take longer time to do things, and not only because a lot of the times they're just practicing things, and like for the perhaps first few times, or even some procedures that they did routinely. The reason that they would take a long time is because with each individual step that you're doing, and some of them are extremely simple steps, you need to raise your hand and call the supervising person to give you approval on that step. Sometimes they have to do adjustments, i.e. the supervisor will tell you, or he tells you to do an adjustment, and definitely it's not the best experience. I'll be fully honest with you, for the patient. Takes extremely long time. They are students, so they are at higher likelihood to make a mistake. And I'm not saying the licensed dentist will not make mistakes. Of course they will. Definitely throughout their career.
The NHS was probably the most important change in British dentistry. After all, for the first time, ordinary people could afford to go to the dentist. But the democratization of dental care did not lead to significant changes in our attitudes. Most people would still only go to the dentist if forced to by pain.
I would say this is
NHS
partly true.
dentists
Not all patients are following up with the dentist as frequently as they should, and that shows in the data where they would screen elderly and older patients for gum disease, gum problems, dental problems. It's still very, very common.
Work wonders fixing Britain's rotten mouths. That was only half the battle. The war for Britain's teeth would be won not in the dentist's chair, but in the bathroom. Of the thousands of new innovations and dental products that found their way into British homes, there was one that really would transform the state of our teeth.
I've heard a great deal about a chemical that can be used on the teeth to help prevent decay. Is that a good thing to use?
It certainly is. We use a fluoride solution, and we have evidence that for some people, this fluoride
So
treatment
that is
helps prevent
probably the
decay.
most accurate, perhaps, advertisement I've seen. But again, it's created. Definitely, it was done to raise awareness in relation to toothpaste. Now, a lot of people are gonna go rally against fluoride in the comment section. I've talked about this multiple times. Fluoride, unless you misuse it, you swallow a significant amount, you do something really wrong with it, is generally safe, except if you have allergies to it or something. If you have a particular problem, like an actual medical issue problem with fluoride, that's when you look for toothpaste that are not with fluoride. However, it has a lot of positive things that adds to the toothpaste. As I said, it helps in prevention of the dental caries and cavities to form.
The addition of fluoride to toothpastes and some water supplies, coupled with increasing numbers of people cleaning their teeth, had a dramatic impact on British mouths. In the 1960s, over 40% of all adults had no teeth at all. But by the year 2000, that figure had fallen to just 6%. British mouths had been transformed beyond recognition in just a few decades, And today, a set of healthy, straight white teeth is considered a mark of wealth and success. If you can afford it, you too can be the proud owner of a perfect smile. A visit to the dentist today is unrecognizable from just 100 years ago, let alone from the days of the brutal barber surgeon. But despite all of the advances of the past 500 years, 1 in 10 of us are still terrified at the prospect of a dentist poking and prodding at our teeth. In some ways, it's not surprising. Our mouths are among the most personal and sensitive parts of our body. So strong
Okay,
reactions
so thank
are
you everyone
understandable.
for watching. Let me know in the comment section were you also surprised with the historic practices and how dentistry evolved from the extreme barbaric things that were being done to you, the patients of medieval times, and the evolution of the toothbrush, the evolution of dentists, and the come up of dentists with academic backgrounds, with the focus on safe dentistry, infection control, all of these things. Dr. Mo, thank you for watching, and goodbye.